was very much inspired by my grandmother, who lived with us when I was going through high school and became quite ill. And I had to take her to the doctor's appointments and listen to how the doctors cared for her. And I knew that taking care of older adults was where I needed to be.
My grandfather actually received a kidney transplant at the age of 50, and I was able to observe how it truly changed his life and how having amazing physicians advocate for him to ensure that he got the best care possible, regardless of what he looked like. I decided that that's what I wanted to do with my life.
So I started as a candy striper volunteer at my local hospital, and I think that was where my enjoyment and love of medicine began. But I wanted to be a decision maker. I wanted to be somebody who could interact directly with patients and help them make good decisions. So that's probably where it all started.
I remember my mother's doctor walking into a room with a cigarette in his hand, opening the door and saying, "You have cancer. I'm going to send you to MD Anderson." And the first thing I thought about is, that's not the way you talk to somebody. That's not the way you deliver bad news. A physician should be compassionate, should be caring, should really connect with their patients rather than just open the door and tell them, here's your diagnosis. So that really actually made me think and say, what would it be like if I could be somewhat more understanding and more compassionate?
It's a long process to not only get into healthcare, but then as you get into it, there's constant changes. And the majority of the treatment that we do for our patients, you don't see it right away. Help improve people's health, to help prevent disease and also treat a lot of diseases. It's a process that takes an extreme amount of patience and understanding.
What inspired me to become a doctor was the need that my community needed for doctors that took care of their health.
I've always sort of wanted to. In high school, I worked in a hospital as an orderly. Probably I was the little guy that was taking you up from your room and rolling you down to the ER or the surgery or x-ray, wherever you were going. And then I worked for a series of doctor pathologists.
Was, believe it or not, a career placement questionnaire. I did not always know I wanted to be a doctor. Never had any role models in medicine. The first thing on that questionnaire in terms of what would be a great profession for me to do in my life is medicine. And I'm very glad that I did that because it helped me choose my passion, and that's being a healer.